The ankle joint allows smooth movement between the leg and the foot. Bones are connected through a stable joint structure. Cartilage provides cushioning between the bones. This reduces friction during movement. Healthy joints allow comfortable walking. The ankle supports body weight effectively. Movement remains flexible and stable. The joint absorbs impact during motion. This ensures smooth daily activity. A healthy ankle functions without pain. Over time, joint surfaces may become damaged. Cartilage can gradually wear down. Bones may begin to rub against each other. This leads to stiffness and discomfort. Movement becomes more difficult. Pain may occur during walking. Joint space begins to narrow. Inflammation may develop in the joint. Mobility becomes limited. Daily activities are affected. The condition may worsen over time. The joint loses its smooth function. The ankle becomes unstable. Medical evaluation becomes necessary. Treatment options are considered. A doctor examines the ankle carefully. Movement and flexibility are evaluated. Imaging scans provide a detailed view. Joint damage is clearly identified. Severity of the condition is assessed. Treatment options are explained. Ankle replacement is introduced as a solution. The procedure is described in detail. Expected results are discussed. Preparation begins for surgery. The procedure begins in a controlled environment. The ankle joint is accessed carefully. Damaged joint surfaces are removed. The area is prepared for the implant. The implant components are positioned. The joint alignment is adjusted. Artificial surfaces replace damaged areas. The implant is secured in place. Smooth joint movement is restored. The structure is stabilized. The joint functions with the new implant. Movement becomes smooth again. The procedure is completed carefully. The joint is properly aligned. The ankle appears stable. All components remain secure. The replacement is fully in place. The joint is ready for recovery. The procedure concludes successfully. Healing begins after surgery. The ankle begins the healing process. The implant settles into position. Movement gradually improves. Pain reduces over time. The joint becomes more stable. Walking becomes easier. Mobility continues to improve. The joint regains function. Strength returns gradually. Recovery progresses successfully. The ankle moves smoothly again. Walking becomes comfortable. The joint functions naturally. Daily activities are restored. The patient regains confidence. Movement feels stable and balanced. The joint performs efficiently. Quality of life improves significantly. The result appears natural and effective. Ankle replacement restores mobility and comfort.